Hello students, this is a practical class on health anxiety inventory. This is a scale to assess the health anxiety of people. The scale was developed by Salvowskis, Remes, Warwick and Clark in 2002. In short, we can say it was developed by Salkovskis et al. Some people, they are so much disturbed by some thoughts and feelings related to bodily pains, bodily illness, that it seems to them that most of the time they are affected with illness. And this is a serious condition, and if we use a scale to assess this condition, the treatment process of any disease can be helped or it can be accelerated. Health anxiety inventory is a scale which will help us to measure a condition which is called hypochondriasis. Now let us look at what is this condition which is called hypochondriasis. And it is a disorder which is marked by intense fear of having a severe illness, and that is when a person experiences some kind of pain in any part of the body. They assume that they have a serious illness, and in extreme form, when this anxiety manifests itself, they may have persistent symptoms that the pain may seem to last for more time, and this condition is known as hypochondriasis. It can occur at any age, but adolescence is a very critical period, and the adolescent may have psychosomatic symptoms, which means the somatic complaints are those related to the body, physical ailments like headache and abdominal pain, limb pain, and so on. And whereas psychosomatic, that means because of these pains, it gets reflected on the person's feelings. That is why it is called psychosomatic. The person becomes anxious because of this pain. Now there is a shorter version which has 18 items, 14 to 18 items, and this scale which I am going to explain is a 4-item subscale, and it has 60 items. Short health anxiety was developed by Salvowskis et al. In 2002. As I've told you, it contains 18 items. Now, what is the significance of this scale? Patients with this symptom of hypochondriasis, they will show higher scores. That means they have higher anxiety, higher health anxiety. And it was found that it is a reliable and valid measure of health anxiety, and it is useful as a brief screening instrument. Now we will go one by one into all the items, and they are in 4 groups of statements, and the person has to read them carefully and select one which best describes the person's health condition. But they have to select only one. For example, I do not worry about my health. I occasionally worry about my health. I spend much of my time worrying about my health. I spend most of my time worrying about my health. Out of these 4 statements, the person to whom we are going to administer this test, they have to select one. These are the four next set of questions. I notice aches, pains less than most other people of my age. I notice aches, pains as much as most other people of my age. I notice aches, pains more than most other people of my age. I'm aware of aches, pains in my body all the time. Coming to the next set of questions, they are, as a rule, I am not aware of bodily sensation or changes. Sometimes I am aware of bodily sensation or changes. I am often aware of bodily sensations or changes, and I am constantly aware of bodily sensations or changes. So these are the next set of questions. Resisting thoughts of illness is never a problem. That means I can overcome. I can tell myself I will not think about this illness. Most of the time I can resist thoughts of illness. Most of the time. I try to resist thoughts of illness, but I am often unable to do so. Thoughts of illness are so strong that I no longer even try to resist them. So these are the next set of questions. As a rule, I am not afraid that I have a serious illness. I am sometimes afraid that I have a serious illness. I am often afraid that I have a serious illness. I am always afraid that I... So you see, from less stressful to more stressful statement. The last statement. If a person says yes to the last of the two statements, and particularly last, we will assume that the person is having a hypochondriasis. I do not have images of myself being ill, visualizing that the person is sick, being taken to the hospital, so on. I occasionally have images of myself being ill. I frequently have images of myself being ill. Then last statement, always. I always imagine that I am ill. So look at the next group of statements. I do not have difficulty taking my mind off thoughts about my health. I sometimes have difficulty taking my mind off thoughts about my health. I often have difficulty in taking my mind off thoughts about my health. Nothing can take my mind off thoughts about my health. Going forward to the next slide, we have another group of statements. I am lastingly relieved if my doctor tells me there is nothing wrong. I am initially relieved, but the worries sometimes return later. I am initially relieved, but the worries always return later. I am not relieved if my doctor tells me there is nothing wrong. Again, going to the next set of questions. If I hear about an illness, I never think I have it myself. Like COVID, so many people are anxious that they will get COVID-19. At the same time, many are also not anxious. If I hear about an illness, I sometimes think I have it myself. If I hear about an illness, I often think I will have it myself. If I hear about an illness, I always think I have it myself. If I have a bodily sensation or change, I rarely wonder what it means. Please ponder. If I have a bodily sensation or change, I often wonder what it means. If I have a bodily sensation or change, I always wonder what it means. If I have a bodily sensation or change, I must know what it means. I usually feel at very low risk for developing a serious illness. I usually feel at fairly low risk for developing a serious illness. I usually feel at moderate risk for developing a serious illness. I usually feel at high risk for developing a serious illness. So these are again the next set of questions. The person has to mark yes to any of these four statements. I never think I have a serious illness. I sometimes think I have a serious illness. Or the person may think that he is having a serious illness, and the person may actually think that he is seriously ill. If I notice an unexplained bodily sensation, I don't find it difficult to think about other things. The person can concentrate on other things rather than the illness. If I notice an unexplained bodily sensation, I sometimes find it difficult to think about other things. If I notice an unexplained bodily sensation, I often find it difficult to think about other things. If I notice an unexplained bodily sensation, I always find it difficult to think about other things. All the time the person concentrates on the illness. So these are the next group of statements. My family friends would say I do not worry enough about my health. My family friends would say I have a normal attitude to my health. My family friends would say I worry too much about my health. And my family friends would say I'm a hypochondriac. Now for these statements, one has to think that he is having a serious illness, and which may be a heart disease, cancer, or multiple sclerosis, etc. Basing on the estimate, like assuming what the situation would be, the person has to find out the sentence that best suits his mental state. So this is the first statement. If I had a serious illness, I would still be able to enjoy things in my life quite a lot. If I had a serious illness, I would still be able to enjoy things in my life a little. If I had a serious illness, I would almost completely unable to enjoy things in my life. If I had a serious illness, I would be completely unable to enjoy life at now. So these are the next group of statements. If I developed a serious illness, there is a good chance that modern medicine would be able to cure me. So from the positive, it's going to the negative gradually. The last negative statement is if I developed a serious illness, there is no chance that modern medicine would be able to. A serious illness would ruin some aspects of my life. The next would ruin every aspect of my life. The person may be thinking it will uh, affect his mobility, the finances, the social life, family life, so in all aspects. So these are the next group of statements. I will feel that I am not losing my dignity due to the illness. Last statement says I will lose my dignity. That people may look at me with sympathy for not being able to perform my normal activities. So in that case, I may totally lose my. Now to conclude, it was adapted and validated in various cultures and languages, including Portuguese, Turkish, German. So these are the people who validated this instrument. Spanish, Polish, North America, Dutch. And it was found that this adaptation facilitates cross cultural comparisons and permits extending psychological science beyond particular cultural background. That means it is applicable to different geographical backgrounds. And in summary, it was found, some studies found that health anxiety inventory is a reliable and valid instrument for measuring the hypochondriasis condition of the person and the related conditions, and so that the person can be uh, given proper counseling, and treatment measures can be taken properly suited to the mental status of the person. And it measures three cognitive domains of health anxiety, including the perceived likelihood of having an illness, anticipated negative consequences of having an illness, and body vigilance. That means always being alert and being trying to find out what is happening to the body, trying to a person checking his breath, and maybe he has the ideation that his breath is will stop, that he will no longer be able to breathe and things like that. So these are the references. There are many references, many research studies conducted by using this scale. Thank you.